What if I told you that the reason your feet feel like 2 blocks of ice every single night has absolutely nothing to do with the temperature in your house and everything to do with one critical nutrient that most people over 70 are severely deficient in? I'm talking about a deficiency so common among seniors that researchers at Johns Hopkins have called it a silent epidemic, and yet most doctors never test for it. Stay with me for the next few minutes, because what you're about to learn could genuinely change the way you feel from the waist down. And I don't say that lightly. If you are over 70 years old and you regularly deal with cold feet, tingling in the legs, that heavy aching sensation after walking even short distances, or that strange numbness that seems to come and go without any explanation, you are not imagining things. You are not just getting old. And this is absolutely not something you simply have to accept as your new normal. There is a physiological reason this is happening to your body, and there is a nutritional solution that medical research has been pointing to for years. So let's get into it. First, let's talk about what is actually happening inside your legs and feet as you age, because once you understand the mechanism, everything else is going to make perfect sense. Your circulatory system is a network of blood vessels, arteries, veins, and tiny capillaries that deliver oxygen and nutrients to every single cell in your body. When you're young, this system functions beautifully. Blood pumps efficiently, vessels are flexible and responsive, and your extremities stay warm and well supplied. But as the decades pass, something changes at a fundamental level. The walls of your blood vessels begin to lose their elasticity. The smooth muscle that lines those vessels becomes stiffer. Nitric oxide production, that's the molecule your body uses to signal blood vessels to relax and widen, begins to decline dramatically. And on top of all of that, years of dietary patterns, oxidative stress, and inflammation begin to narrow the pathways through which blood must flow. The result? Less blood reaches your lower legs and feet. And when less blood reaches a part of your body, it gets cold. It tingles, it aches, it feels numb. That's not aging in the abstract. That's a very specific, very real mechanical problem happening inside your vascular system right now. Now here's where the vitamin conversation becomes so important and so fascinating. The nutrient I want to talk to you about today is vitamin B3, also known as niacin, and specifically a particular form of it called niacin or nicotinic acid, not to be confused with niacinamide, which is a different form that does not have the same circulatory effects. We're talking about true niacin, nicotinic acid, and the research behind what it does to your peripheral circulation is nothing short of remarkable. Here is why niacin stands apart from almost every other supplement in terms of blood flow. Within 15 to 30 minutes of taking a therapeutic dose of niacin, your body triggers what is called a flush response. You may have heard of this. It's that warm, tingling, sometimes reddish sensation on the skin. Most people are initially alarmed by it. Some people actually stop taking niacin because of it, thinking something is wrong. But here's what you need to understand. That flush is not a side effect. That flush is the mechanism. What you are feeling is your blood vessels dilating. Specifically, the capillaries, the tiniest blood vessels in your body, the ones closest to the surface of the skin, and the ones that reach all the way into your fingers and toes are opening up, widening, allowing dramatically more blood flow through them. Studies published in peer-reviewed cardiology journals have shown that niacin can increase peripheral blood flow by measurable, significant percentages. The vasodilation it triggers is one of the most potent, natural, and rapid circulatory responses you can produce without pharmaceutical intervention. And for someone whose feet have been ice cold for years, that warmth you feel during a niacin flush is not just a sensation. It is biology working in your favor. But niacin's benefits go far beyond just dilating blood vessels in the short term. This is where it gets even more compelling. Niacin has a well-established, decades-long track record as one of the most effective natural agents for improving your full lipid profile. We're talking about raising HDL cholesterol, that's your good cholesterol, sometimes by 25 to 35%. We're talking about significantly reducing triglycerides, which are those fats floating in your bloodstream that contribute to arterial plaque buildup. And here's the connection that most people never make. When your arteries have less plaque, when your triglycerides are lower, when your HDL is higher and doing its job of cleaning out arterial walls, your blood flows more freely through every vessel in your body, including the ones in your legs. This is a long-term circulatory benefit operating in parallel with the short-term vasodilation benefit. You're essentially getting two mechanisms of action from one nutrient. Now, niacin doesn't work alone in this process. And this is the part I really want you to pay attention to, because understanding the full picture will help you make smarter choices. There is a second nutrient that works synergistically with niacin to amplify its circulatory effects, and that nutrient is vitamin E, specifically the natural form called d-alpha-tocopherol, not the synthetic d-alpha-tocopherol you often find in cheaper supplements. Vitamin E is a fat-soluble antioxidant, and its primary role in circulation is both powerful and often overlooked. Here is what vitamin E actually does at the cellular level. It inhibits the oxidation of LDL cholesterol. You see, LDL cholesterol on its own is not particularly dangerous. It's when LDL becomes oxidized that it starts to damage arterial walls and trigger the inflammatory cascade that leads to plaque. Vitamin E essentially acts as a shield, protecting those LDL particles from being oxidized and therefore protecting your arteries from the kind of chronic damage that progressively restricts blood flow over time. Multiple studies, including large-scale trials from Harvard and Cambridge, have confirmed that adequate vitamin E status is strongly associated with healthier vascular function in older adults. But there's more to vitamin E than just antioxidant protection. Research has also shown that it has mild antiplatelet properties, meaning it helps prevent blood platelets from clumping together unnecessarily. When platelets clump, they make blood stickier and harder to push through narrowed vessels. For someone already dealing with compromised peripheral circulation, sticky blood is the last thing you need. Vitamin E essentially helps keep your blood flowing smoothly through those vessels, working in the direction of better circulation from a completely different angle than niacin. And when you take the two together, niacin opening and widening the vessels, vitamin E keeping the blood itself cleaner and less sticky, you have a genuinely powerful 1-2 combination. Now let's bring in a third player, because no discussion of circulatory health in seniors would be complete without addressing vitamin D3, and specifically the way it connects to the muscular health of your vascular walls. Most people know vitamin D as the bone vitamin or the sunshine vitamin, and yes, it plays critical roles in calcium absorption and bone density. But what often gets overlooked is that vitamin D receptors are found on the smooth muscle cells that line your blood vessels. This is significant. When those smooth muscle cells are well supported by adequate vitamin D, they are better able to relax and contract appropriately. When you are vitamin D deficient, and research consistently shows that somewhere between 70 and 90% of adults over 65 are indeed deficient, those vascular smooth muscle cells begin to stiffen. They lose their responsiveness. And stiffer blood vessel walls directly translate to higher blood pressure, reduced circulation, and yes, colder extremities. A meta-analysis published in the journal Hypertension found that vitamin D supplementation in deficient individuals produced meaningful reductions in blood pressure and improvements in vascular function. Getting your vitamin D levels tested and correcting a deficiency, if you have one, is not optional if you are serious about your circulatory health. Here's something I want to address directly because I hear this question all the time. If these nutrients are so important, why don't I hear about them from my doctor? This is a completely fair question, and the honest answer is multifaceted. First, medical education has historically prioritized pharmaceutical interventions over nutritional interventions. That's simply the reality of how medical training works. Second, and perhaps more importantly, deficiencies in nutrients like niacin, vitamin E, and vitamin D often do not produce obvious acute symptoms that make a patient come into the clinic. The effects of these deficiencies are slow, cumulative, and gradual. They unfold over years and decades, which makes them extremely easy to attribute to just aging. Third, standard blood panels don't automatically test for all of these levels. You often have to specifically request testing for vitamin D and discuss with your physician whether your symptoms warrant a closer look at your nutritional status. So please, do not mistake silence from your healthcare provider on this topic as confirmation that nutrition doesn't matter. It does. It matters enormously. Let's now talk about practical application, because information without action is just entertainment, and I want this to actually help you. In terms of niacin, the form and dosage matter significantly. The flush-producing nicotinic acid form is the one with circulatory benefits. Doses typically used in clinical research for cardiovascular benefit start around 100 milligrams and scale upward, but I want to be clear that you should always introduce niacin slowly and ideally under the guidance of a healthcare provider, particularly if you are on any blood pressure or cholesterol medications, because niacin is genuinely powerful and can interact with those medications. Start low, go slow, take it with food, and understand that the flush diminishes significantly as your body adapts over the first few weeks. For vitamin E, look for natural d-alpha-tocopherol and include mixed tocopherols if possible. For vitamin D3, most adults over 70 benefit from 2,000 to 4,000 IU daily, ideally taken with a meal containing healthy fats since it is fat soluble. And pairing it with vitamin K2 is something more and more practitioners are recommending, because K2 helps ensure that the calcium mobilized by vitamin D is directed to your bones and not to your arterial walls. Beyond supplementation, there are lifestyle practices that directly enhance the effectiveness of these nutrients and amplify their circulatory benefits. Hydration is the first and simplest one. When you are dehydrated, your blood literally becomes thicker and more viscous, and thick blood is harder to push through already compromised vessels. Seniors are chronically and systematically underhydrated, often because the thirst mechanism becomes less reliable with age. Drink water consistently throughout the day, not just when you feel thirsty. The second practice is movement. Specifically, the kind of movement that recruits your calf muscles, because the calves act as a secondary pump for your venous circulation. Walking, calf raises while standing at the kitchen counter, ankle circles while seated. These simple movements activate what's called the calf muscle pump and physically push blood back up from your legs toward your heart. Even 5 to 10 minutes of gentle calf movement several times a day can make a noticeable difference in circulation and foot warmth. The third practice is temperature management. While warming your feet with a heating pad can provide temporary comfort, what truly improves the situation long term is addressing the internal circulation, which is exactly what we've been discussing. Contrast hydrotherapy, alternating briefly between warm and cool water on the feet and lower legs, has shown promise in some research for stimulating vascular tone and reactivity. I also want to take a moment to talk about what you should actively avoid, because protecting your circulation is just as much about removing harmful influences as it is about adding beneficial ones. Processed foods high in refined sugars and trans fats are among the most damaging things you can expose your vascular system to. They promote inflammation, contribute to arterial stiffness, and accelerate the very damage that restricts circulation. Excessive sodium can cause water retention and increase blood pressure, further straining your vascular system. Prolonged sitting without movement, smoking, or exposure to secondhand smoke, and chronic stress are all known to significantly impair peripheral circulation. If you are in an environment where any of these factors are present in your daily life, addressing them is not secondary to nutrition. It is equally important. One final thing I want to highlight before we wrap up is the often ignored connection between gut health and circulation. Emerging research over the last decade has revealed that the microbiome, the community of bacteria living in your digestive system, plays a direct role in regulating vascular inflammation and endothelial function. The endothelium is the thin inner lining of your blood vessels, and healthy endothelial cells are crucial for producing nitric oxide. That molecule we mentioned at the beginning that tells your blood vessels to relax and widen. A disrupted microbiome, which is extremely common in seniors due to antibiotic use, dietary changes, and reduced digestive function, can impair nitric oxide production and increase vascular inflammation. Including fermented foods like yogurt, kefir, or sauerkraut, and prebiotic fibers from vegetables and legumes supports the microbiome that supports the endothelium that supports your circulation. It is all connected in ways that modern science is only now beginning to fully appreciate. So let's bring it all together, because this has been a lot of important ground to cover. Poor leg circulation and chronically cold feet in adults over 70 are not inevitable consequences of aging. They are consequences of specific addressable deficiencies and lifestyle factors. Niacin, in its true nicotinic acid form, produces powerful vasodilation and long-term lipid improvements that directly open peripheral circulation. Vitamin E protects arterial integrity and reduces blood viscosity. Vitamin D3 supports the flexibility and responsiveness of vascular smooth muscle. Together, these three nutrients form a nutritional foundation for circulatory health that is backed by decades of peer-reviewed research and is accessible to virtually anyone. Pair that foundation with consistent hydration, regular calf-activating movement, an anti-inflammatory diet, and a gut-healthy lifestyle, and you have a comprehensive, holistic approach to restoring the warmth, comfort, and vitality in your legs and feet that you deserve to feel. If you found this information valuable, and I genuinely hope you did, please take a second right now to subscribe to the channel so you never miss a video. Hit the like button because it helps more people over 70 find this kind of content, and drop a comment down below letting me know what health topic you want me to cover next. Your comments shape what I create, and I read every single one of them. Thank you so much for watching, and I'll see you in the next one.